How has post-void residual volume testing evolved? Have you ever wondered how medical testing for bladder health has changed over the years? One important test is the post-void residual volume test, which measures how much urine remains in the bladder after urination. This test has come a long way, evolving from invasive techniques to more comfortable, non-invasive methods. Let's explore this journey together. In the past, the gold standard for measuring post-void residual volume was urethral catheterization. This method involved inserting a tube into the bladder to drain and measure the remaining urine. While it provided accurate results, it also came with risks like urethral trauma and infections. Because of these complications, healthcare providers sought better alternatives for routine testing. The major breakthrough came in 1967 with the introduction of ultrasound technology. This non-invasive imaging technique allows doctors to visualize the bladder and estimate urine volume based on its dimensions. By 1988, ultrasound was recognized as the standard method for measuring post-void residual volume. This shift significantly reduced the complications associated with catheterization, making testing safer and more comfortable for patients. Today, most post-void residual volume testing is done using portable abdominal ultrasound devices. These devices use curvilinear probes that operate within a frequency range of 2 to 7.5 MHz. They provide cross-sectional and sagittal images of the bladder, allowing clinicians to measure its depth, width, and height. The bladder volume is then calculated using a specific formula that includes a correction factor. This method is quick, safe, and repeatable, making it suitable for various clinical settings, including outpatient clinics and emergency departments. Recent studies show that ultrasound-based post-void residual volume measurement is highly accurate when performed by trained operators. However, some variability can occur due to factors like operator experience and patient conditions, such as pelvic organ prolapse. To enhance accuracy, techniques like reducing prolapse during measurement have been investigated. In clinical practice, ultrasound testing for post-void residual volume is crucial for detecting urinary retention and voiding dysfunction. This is especially important for monitoring bladder health in patients with bladder cancer, particularly after treatment when bladder function may be affected. Normal post-void residual volume values can vary by age, but generally, they are considered to be less than 50 milliliters in younger adults and less than 100 milliliters in older adults. In summary, post-void residual volume testing has transformed from invasive catheterization to primarily non-invasive ultrasound methods. This evolution has improved safety, patient comfort, and diagnostic efficiency while ensuring the accuracy needed for managing bladder health and bladder cancer. If you have concerns about bladder health, it is always best to consult with a healthcare professional for personalized advice.